Did you know that a woman's fertility decreases from the ages of 30 and significantly reduces from the ages of 37? Yet so many women during this age group are pursuing their careers, personal goals, and also making significant milestones in their lives. That is why the topic today speaks to every woman out there. It talks about career growth, fertility, and planning for motherhood without pausing your dreams. At Women's Hospital International and Fertility Center, we understand the significance of partnering. And it is important today, and these conversations, to women today with AAR General Insurance to empower women with knowledge in order to make informed decisions about their reproductive health.
Welcome to our podcast. My name is Leah Asiimire, Head Marketing, Brand and Communications here at AAR General Insurance Uganda. I'm honestly very delighted to be part of this conversation as we celebrate the Women's Month. To navigate this important conversation, we are joined by one of our reward partners, Women's Hospital International and Fertility Center. And with me, I have Dr. Leah, who is ready to have a conversation with us.
Thank you very much, Leila, for having me here today. And I'm very pleased to be here. My name is Dr. Leah Asiimire. I'm a medical doctor at Women's Hospital International and Fertility Center. I'm very passionate about women's and child's health. And as a woman living in the modern era, I've had experience trying to build my career, trying to achieve my different dreams, balancing with family life and also motherhood. In my clinical experience, I've appreciated that women out there need to have accurate information about their reproductive health, how it resonates with their fertility. And today, I'm pleased to create awareness, inform women the different options that we have as we pursue our different careers. Thank you very much.
Thank you, Dr. Leah, for introducing yourself and sharing your experience. We see lots of women in big spaces focusing on career growth. For you as a doctor, tell us, how does age and career limit fertility?
One, before I answer your question, do you believe how you were when you were in your primary is the same way you look right now?
Of course, no.
Of course not. So you can appreciate that over time you've had changes physically on your body, what you can see. One, now, for example, I myself, I used to be very small, but right now I think I've grown. People tell me, oh, Dr. Leah, you've increased in size. So what does that mean? That as we age, as we continue growing, a lot keeps changing. So it is going to change externally, and a lot of changes also are changing in our bodies, okay? And now, particularly for us women, we change a lot. And we have to appreciate that our age plays a very, very vital role as regarding our fertility, okay? We are born with specific number of eggs over time, and they keep decreasing in their quality and their quantity over time. That is to say, as we age, okay? Yeah. So in our 20s, when we are in our 20s, our fertility rates are at the peak, okay? And we reach our early 30s, we have a gradual decline in our fertility rate, okay? Then by the age of 35, we have had a rapid decline, but not as compared in our 30s. And we have seen that now when women reach the age of 40, it becomes more difficult to start conceiving by natural conception. But that does not mean that, Leila, if you're in your 30s, you're not going to conceive.
They're not going to conceive.
You can still conceive and have a healthy pregnancy. Only what we have to appreciate is that it may not be as easier as it would have been if you are in your in your early years, okay? So as we try to pursue our careers, we have to understand that age is going to keep playing a very vital role. But we should not limit our careers. Let's have information. This is why reproductive fertility awareness is very important, so that women are able to balance their reproductive health and their career growth.
Okay, doctor. Thank you for highlighting that. We've often had a biological clock. Can you help us break it down and help us understand what reproductive health is and also how the biological clock plays into that?
One, is biological clock a myth? No, it's not a myth. I know some women think it is a myth, but it's actually there. So to define a biological clock, it is a natural decline in the fertility of a woman as she ages. That is how we define a biological clock. So to expand on that, one, the day that I was conceived in my mother's womb, that I'm going to be a woman, by 5 months of age, I have a specific number of eggs that I have, and that is around 6 to 8 million eggs. By birth, after 9 months, I was born in August, 9th of August. So that day when I was delivered, already I had a decline in the number of eggs. So by birth, we have 2 million eggs that are remaining. And then we wait for our puberty, and that is around 13 years average. We have 12 to 13 years of age. So by puberty already, we have already lost around 300,000 to 500,000 eggs. That is by puberty, okay? And by the age, so every menstrual month that you get as a woman, you're losing 15 eggs are lost. So just imagine, like right now, how old are you? You may be, maybe let's say 33, okay? Yeah, so if you started your period at the age of 14 and now you're 33, so you've had this whole gap of around 20 years of losing those eggs. And as women, we are unfortunate that we do not make more eggs like men. The men, for them, they keep making sperms throughout their life, as opposed to us women who are born with the specific number of eggs, and we keep losing. So the clock, what we mean by that clock is that as we age, the eggs are decreasing, and not only the quantity, also the quality of those eggs keep decreasing. So why is this biological clock very important for us to know? One, it helps us to plan our fertility very well. Like I already told you previously that in the peak fertility is in our 20s. We notice a decline in our early 30s, then a very gradual decline in 35, and over 40 it starts becoming very difficult. So we will see that also the quality of those eggs in 20s is going to be good, decrease to in 30s, then also above 35, we've noticed a very bad quality in those eggs. And also that means, of course, if the quality of the eggs is also not good, the risks of miscarriages. When women, we see women, you are at a very high risk of getting a miscarriage when you conceive in your above 35 than when in your 20s. Not that those women in 20s will not miscarry, but the risks keep increasing as we age. Then also the risk of chromosomal abnormalities is also high as we age. So that is also why it is very important for us to know that this biological clock actually exists, and we have to have adequate information on how it works so that we can plan very well. Also, another thing, when we look at this biological clock, because someone will know, of course, one, you know as you age, your biological clock, every time you celebrate your birthday, you know your clock is ticking, so you have to know, every time I'm cutting that cake on my birthday, I'm cutting. I've already lost some eggs. So you've lost some eggs on that. It may be that month that you're celebrating your birthday. Maybe you're in your menses. So you've lost eggs that day around 15. So every time you cut that cake, keep that at the back of your mind. So now, as you're planning this career, you have to know if today, Leila, I'm 30, I've celebrated my 5th birthday today, and I'm trying to achieve this. Do I know where I'm standing? So which tests do we do? Okay, let's say for this woman out there who is trying to balance both. We normally do one. Now, to take us back, someone may want to know, do I need to have tests done when I'm in my 20s? So we try to see, if I'm in your 20s, you do not have to rush to start, let me have my hormones checked, unless there is a medical reason for having those tests done. For example, you see your periods are not regular, you get a period this month, the other month you're skipping 3 months, okay? That's when you may need that to go to the hospital and you have tests done. But if you see you're having your regular periods, you do not need to have that rush of going to do those tests. Now, when you start in your 30s and you've had 1 year of trying to conceive and you're not seeing anything, you're delaying to conceive, then I need to visit the hospital as early as possible so that you do not wait for the other age I've told you where we keep seeing that gradual decline, okay? So you can come to the hospital. Of course, the doctor is going to take your history, what you've been trying to do, then the investigations that we do. One, we are going to do a scan. That scan is going to help us see what is our egg count at this moment. Okay, remember I've told you there is always that decline every month. So when we do that scan, it is going to help us see what we call antrofollicular count. We measured, we see how many eggs are we talking about at this age. Then also we check blood. That blood we measure what we call hormones. These hormones are made in your brain, they move through your blood. So we check them by checking blood. Then also for most women who are over their 35, there is another hormone that we add from the normal hormones that we check. It's called anti-Mullerian hormone. It is also a test that we do that helps us know the quality of the eggs. So the biological clock, the take from this is that it is real, it's not a myth, and every woman has their biological clock.
Thank you for explaining that in detail. And allow me to jump into a question around women that are posing. People who are choosing to focus more on career and they are choosing to maybe give birth later on in life. What are those options you have for them in your hospital in particular?
Very many options. As we said, this is a modern day era, okay? And these are there are options, first of all, to answer the question. The options are available, and as previously, of course, before they were not there, but as the world keeps evolving, a lot of technology has come up, okay? So to look, number one, we have what we call egg freezing. Okay, so and this takes us back to our biological clock, okay, where we know that is why we started with the biological clock to know when do I have the best eggs, okay? So if I plan, for example, I'm now a medical doctor and I want to go back, do my master's degree, and I know if I'm to finish my master's degree, I will have, because our master's degree are 3 years, so I can plan earlier. So can I have my eggs frozen now that I know my eggs are the best quality, okay? So we have what we call egg freezing. And to elaborate more about the egg freezing, you as a woman, you receive injections. These injections that help your eggs to grow to a certain size, and then after the eggs are collected without you feeling pain, and those eggs are frozen, okay, and they can be used later in life when you're ready and you've pursued your career, okay. That is option number one. Then another option that we have, it is also freezing, but now what is frozen, it's now for example, Leila, I have my spouse, okay? So you can choose to bring your spouse. We fertilize what we call embryos. We get your eggs, then we fertilize with your husband's sperm, and we freeze the embryo, okay? The first option was to freeze Leila's eggs, okay? Then the second option is to freeze the embryos, the eggs that are fertilized with the sperm. Then there are also there is also another option that can quicken the process, okay? I want to go for my master's next year, okay? And let's say I'm going, for example, you want to go in next year, and you have this whole year, we are still in March. So to quicken the process, we also have what we call in vitro fertilization, okay? So if you've been trying, for example, for a year and you're planning already ahead to go and achieve your career, you can fasten the process by doing what we call in vitro fertilization. So in vitro fertilization is a fertilization that occurs outside the body, okay? And it starts by one, of course, necessary tests are done, okay? And we see if this woman is good enough for this process. She is started on a certain program by receiving different injections for like a period of 2 weeks, okay? So then after that, we collect those eggs, and the spouse gives us a semen sample. We inject the eggs with the sperms, and then we keep them in the lab, okay? So that is why it is called outside the body fertilization, okay, in vitro. Then after that, a period of 3 to 5 days, we are going to get that, we call it an embryo, and we transfer it back into the woman's uterus. And then after a period of 2 weeks, we do a pregnancy test. So now that helps this woman who wants to go back to school, for example, the other year, to plan ahead, okay, faster than waiting for the natural conception. So those are the options that we have available, and you can easily get them at our hospital, at Women's Hospital in Bukoto. So in case you are interested, or you're someone out there who is interested in doing this, you can visit us and we'll be able to help you.
Doctor, thank you for sharing the options available. And clearly, at least now things are here in Uganda, vis-a-vis back in the day where people used to travel and go and look out for these options. But I'm glad they are here in Uganda and with our partner here. So, Doctor, do you have any parting shots?
So at every woman out there who is listening, as we celebrate this month of She Gives, She Gains, women, we give out a lot, and we really need to gain from it. We should not keep giving to career. We give to this, families, and we are not gaining. Let us not just choose one thing and we lose out on the other. So I want to let us know that we can achieve both, okay? With the rightful information, hopefully we've gotten the rightful methods that we can choose if we want to achieve both. So we can know that we have options out there that can help us to achieve both our careers and as we are building the nation. Thank you very much for having me today.
Thank you, Doctor, for your time, for sharing knowledge, for sharing insights. And to my audience out there, I hope you've picked what the doctor said. For me personally, it is key that we pay attention to some of the things that affect fertility. She mentioned something along biological clock. It's no longer myth, it's something that is real. It is happening. When you hear people talk about biological clock, think about it and, take the necessary steps to make better informed decisions. She talked about the options available. And these are options that are available in Uganda. You don't have to travel abroad. We have egg freezing, embryo freezing, IVF, these services are all available in Uganda, and also the young women out there. Personally, me in school, I never thought that you wouldn't get pregnant after 30, you know. So for the doctor to emphasize that our 20s are those years where our fertility is peak, it is something that we should know as the younger generation, because we don't want people now to get into the struggles of fertility. People are struggling silently, and some of them are wondering, I wish I knew. So for me, I feel like this is something that we should focus on as we try to chase our careers, as we try to juggle through life, as we try to go back and study. We need to have the information, because at the end of the day, information does everything. When you know something, you're able to control certain situations in your life. And from me to you, this has been an engaging conversation with Dr. Leah. I'm happy, and I promise that we are going to come back with more engaging content so that we inspire, we educate to make our lives better. Thank you very much.